welcome to a very special episode of Super Bulky. It is October. October is here. And so we are joined by a very special guest this month. Let me introduce Jackie Engstrom, or as we call her, Nurse Jackie, around here, who's here to talk to us about a subject that is very, very prevalent in October, which is breast cancer. And the big fiber arts relation to Breast Cancer Awareness Month is the Knitted Knockers program.
Yes,
and this is your career at this point, breast cancer.
Yes, and breasts and knockers.
Breasts and knockers. So we joke that at this time of year, any time of year really, Jackie goes around town getting her knockers out wherever she can. So she's here today to get her knockers out for us.
I'm here to show you my knockers.
So tell us about Jackie. Who are you?
So I'm a nurse. I've been a nurse for over 30 years. I did my nurse training in England and moved out here almost 30 years ago. But for the past 6 years, I've specialised in cancer. And for the last 3 years, specifically breast cancer. So I'm the nurse navigator at one of our local cancer centres. So all of my patients have breast cancer, men and women. And so I follow them from diagnosis through the end of their treatment with anything they need and helping them to get through it.
And you have been a nurse for quite a long time. What about the fiber arts? How did you get involved with that? When did that come into your life?
That came into my life when I was a young girl in England. My godmother was knitting away, and I'm clacking her knitting needles, just pretending to be like her. And she said, well, if you're going to do that, you're going to learn. So she and my great aunt taught me how to knit. So I've been knitting from a very, very young age. But when I became a breast cancer nurse, one of my patients also knits, and so I always ask them what their hobbies are. So because as they go through their treatment, I want them to continue doing the things that they love to do. And she said to me back in 2016, well, I love to knit. I said, oh, me too. And that started a conversation of, did you know about knitted knockers, which I did not know about at that time. So that's how my two worlds kind of intersected.
They collided.
Yes.
So in 2016, you found out about the Knitted Knockers.
Yeah.
Do you know when the organization began?
2011.
2011.
Yeah, it began actually with a British lady who knitted a knocker, or came up with a pattern for a friend of hers. And they originally called them Titsbits. But then their name was eventually changed to Knitted Knockers.
So that's really a great origin for what has become a worldwide endeavor, starting with a knitter helping a friend.
Yes.
And it's become a worldwide initiative.
Yeah, and the Knitted Knockers are all over the world now. It's
so
amazing.
They take up a fair bit of your work, it seems.
Yes, they do.
Your Knitted Knockers have a lot to do. So when they integrated into your work at the Cancer Center, how did that happen? From you finding out about them to becoming this involved in...
Well, I knew that I looked it up. I realized I really wanted to do this, but I also knew I would never be able to knit all those knockers on my own. There's just no way. I wouldn't have enough time to do it. So I was thinking, well, how can I reach out to other knitters? I didn't really know any other knitters in town. And it just so happened I was flicking through our local newspaper, and it said that What the Knit Guild was having an open house that weekend.
That's our local guild here in Bakersfield.
Yeah, so I thought, well, I'll go along to that and see if anybody's willing to help out work on the knockers.
And they were.
And they were, yeah. Originally, they had said they had tried the year before, but they couldn't find anybody in the cancer centres to gain traction. And of course, then I come along. I've got the ladies who need the knockers. They've got the talents to knit the knockers. So we merged the two of them. And since we gave our first one out in August of 2016, and to date, we've given out over 600 knockers.
That's incredible.
Yeah.
That's incredible.
Yeah, it's amazing.
So we've talked a lot about them up until now, and we promised at the beginning that Jackie would be getting her knockers out.
Right?
So let's take a look at them. If you haven't seen them before, they are hand knitted or also crocheted, yes.
Yep.
Soft prosthetic breasts. So let's take a look.
So when we have them in all sizes, this is an A-cup knocker. So they're very, very light. The ones that the ladies get from their insurance are heavy silicone plasticky things.
Right.
So, and I know in many areas aren't as hot as us, but in a Bakersfield 110-degree heat day, you don't want a big heavy plastic thing on your chest. So these are much lighter. So this is an A-cup and this is an E-cup. So we have all sizes in between, larger on special order. So,
Right.
so they're very soft and light and come in
Yeah.
all different kinds of colors.
I'm glad you mentioned because, of course, when many people think of a prosthetic, they think of that plasticky bit,
Yes,
right?
yeah.
So the women prefer these sometimes because they're lighter, because they are cooler in areas like this. What else do you think makes these so appealing for people who need them? Is there anything that
they're always free, always free, and so a lady just has to have a need. So people will say to me, well, my sister wants these, there isn't anything in her town, how do I get them? And we just send them out to them too.
How far afield have your knockers gone?
England.
That's pretty far.
Yeah, so, and I've sent them to Palm Springs and Idaho and
Right.
that, you know, so there's been other places, and so ladies can choose. They can even have a multicolored one if they really want one.
Right.
So we ask them, you know, what color do you want? We get them. We try to get them as close to their skin color if that's what they want.
Yeah. And you
know?
you take all skin colors.
All skin colors, yeah, and
important.
we need all skin colors.
When we because we carry the one of the approved yarns, we'll link in the description of the video to the Knitted Knockers website, which carries the list of approved yarns.
And the reason why they do that is because if from feedback from actual patients, they've learned which cottons are more comfortable than others. Yeah. Acrylic ones, these are actually acrylic ones. They're for swimming. Because they don't hold as much water.
Right.
And this is how we present them to the patient in a little organza bag with instructions on how to care for them. But the yarns, there's one particular cotton that they tell people not to use because it's too rough.
Oh, sure.
But mostly the cottons, the acrylics can...
It's going to be a sensitive area. So
very. And people forget that. Yeah. And that's why the back of the knockers have to be very smooth too. As if the back of the knockers has knots and things in it, then it's going to be against the skin so that patients can't wear that. So they've really tried and tested all these yarns with real ladies. So that's why...
we make sure that the yarns that we carry, the approved yarn that we've chosen to stock at the Twisted Skein here, every imaginable skin tone that we could find. Basically, when we look at the catalog, when our dealers come in, our yarn vendors,
the knocker dealers,
if it's a color that conceivably a bra comes in, then we buy it, and we get it in there because there are women who every skin tone are affected by...
And you don't want to give an African American woman a pink one.
Right.
Unless she wants one. You
right.
know, because that can be offensive to them. I mean, they want one in their own skin
And
color.
our community has been very, very good about picking up a wide variety of colors because we live in a very multicultural area.
Yeah.
Right?
And the knitters always say to me, what size do you need? What colours do you need? So, and if I happen to not have any, because I don't keep many swim knockers, I just put the word out, and the next day I've usually got a pair of knockers knitted.
Another thing that our knitters will do sometimes is to stretch the skin tone colors. They will knit the public side in one of the flesh tones, and then use something for the back that's a contrast
a different color. Yeah, I don't have any of
you
those.
You don't have an example, but
yeah.
that's I think a clever way to do it because then you can easily get a pair depending on the size of the cut size, like out of one skein for both fronts, and then you're stretching the back with whatever. And it's a little fun, I think. Just you know. If there's a sort of person who likes something.
Yeah, well, some ladies have knitted in hearts into the design too, and patients like that as well. Yeah. One lady actually put a little nipple ring on there, which one of my patients just loved, and she was in her 80s, and she's like, I want that one.
so you never can tell. Yeah. And I think that's telling because, of course, the people who are affected by breast cancer just cuts a swath through the entire population.
Yes,
and in fact, you were telling me before that you have an abnormally large number of men who've been affected.
This year,
we have less need for knitted knockers, but we do have need for breast cancer awareness if you're a man.
Well, 1 in 8 women will be diagnosed with breast cancer in their lifetime, and 1 in 1,000 men. But for some reason, in the last 6 months, we've had 4 men diagnosed. 2 of them fairly young; they were in their early 50s, and it's unusual. You don't normally we may see 1 a year, but to have 4 in 6 months. has
Yeah.
been quite telling.
Yeah,
you know, so
if you are a man or there are men in your life, you watch out.
Yeah.
Things will
don't
happen
ignore
to
a lump. You
Yeah,
gotta, if you've got a
it's-
lump, you gotta go see the doctor and
we
insist that it
we
gets
put
taken care of.
in, we dress up in pink and we talk about women's breast health. But
Yeah.
of course, everyone has a breast, and sometimes
Yeah.
men forget.
Yeah, men
But-
don't realise, but women, definitely. Obviously, you got to get mammograms once a year, you do self-breast exams, and take care of any lumps that you may find.
The women who have taken your knockers,
Mm-hmm.
I just love, there's no other way to put it, is there? So the women who've taken your knockers, it's affecting for them, right?
Oh,
it's transformative for many of them. You've
Huge.
told us some stories about people who've gone from that
Yeah.
sort of heavy prosthetic to the light, handmade, free
Yeah.
object. So what is
Well-
that like when you?
Well, one lady, she had bilateral mastectomies, had got her knockers provided by her insurance, and called me that afternoon and said, I cannot wear these every day. I'm going to have a bad back. Can I come and get some knockers? And of course, yes, of course you can. And she just loves them. And we always let them know too. Sometimes they can wear out after washing, because you wash them, you just
Yeah.
rewear them. They can come and get another set if they need to, so which they love as well, because they can come back and get it. One lady came in with a blanket to her chest, and apparently she always walked around with a blanket on her chest because she didn't like the fact that she was flat. And then somebody told her about our program. She came in and she walked out without that blanket. That was just fantastic.
That is fantastic.
Yeah, it was great.
Seeing the effect that the
Yeah.
work has
Yeah.
on the people receiving it.
Yeah,
is
and
remarkable.
I was at a public event one day, and I usually always take knockers with me in case somebody comes by and they would like a pair. And one lady refused. She said, I've been flat for 5 years, it doesn't matter. And I said, okay, if you don't take a pair, take my card. And if you do ever want a pair, then you give me a call. She called me 3 weeks later and said, I've got this sundress. I don't wear it because I don't have any breasts, but I really want to wear it, and I figured that maybe I can try it. And she wears them now all the time.
Good.
So it's fabulous.
Now,
So-
we've got some nice utilitarian everyday knockers in here,
Yeah.
but that's not all you get up to.
No.
There are some fun ones in the basket.
Right, yeah.
I can see them. So you have spearheaded an event locally,
Yeah.
and why don't you tell us about that?
Well, now it's going to be our third year. I figured way back when I was starting, I was providing the yarn, I was providing the stuffing and all the organza bags, which I had no problem doing, but I was figuring I might go broke if I continued to do that, because we don't ever want the ladies to ever pay for them. So
Right.
I figured, well, let's have a knitted knocker knit off. Try saying that fast. Where people can make crazy knockers just for the fun of it that obviously wouldn't be worn. However, when I post pictures, people want to wear them. I don't know how they'd wear these in their bras, but so
A spirit of fun.
right, yeah. So I asked the guild again, if I do this, would you support it? And of course, our guild. They'll
Yeah.
support anything that's to do with anything that's charity-wise. So they said, yeah, sure. So we decided that we would have a knitted knocker knit off. It costs $25 to enter. People knit crazy knockers, and we put them on display in the cancer centre in the month of October, which we call Pinktober at the hospital. And people can come and vote on them. And then at our huge breast awareness event, VI Pink, that's when we announce the winners. And of course, the Twisted Skeins also really been so supportive of the knocker
it's very
program in
important to
general.
us, yeah.
But the competition has been fabulous too. So
Get out some of your
these are-
fancy
yeah.
knockers. Let's
So
take
these
a
are
look.
ones that these are breast cancer is utterly bull. That was these won last year for most best interpretation of theme, and these are boobies buzzing by, which won the first year for most creative.
Right.
And this is another pair of Beach Bound Baby. So they've been really well received.
Right.
The hospital itself absolutely loves the program. Our CEO is very highly supportive of it, loves what we do, and supports every year for us to continue to do this event. And we've had, last year we had our first entry from out of town. We had somebody send some in from Texas. This year, Charles Gandy has sent in two pairs of knockers for us to display.
Great.
So I'm hoping eventually that my knockers will go international.
Yeah.
And
So it's probably a bit late for our viewers this year to participate in the local Knitted Knocker Knit Off, but we'll keep everyone posted on when next year opens up, because you can take them from anyone and anywhere.
And people could send them in January if they wanted, and I'd just save
hold on to them. So we'll put some contact information if you'd like more information about the Knitted Knocker Knit Off. If you would like to try and get a similar event started in your area, the more the merrier. If you want to send things in to us here in Bakersfield.
And if anybody needs just a pair of knockers because you have a mastectomy and you need some knockers, just let me know and I will mail them out.
Yeah.
So the hospital's been beside that too. They they let me mail it through the hospital, and they're so supportive, and so the whole community in Bakersfield supports my knockers.
Yeah,
I've got more support from my knockers.
Right, and no underwire.
No underwire, yeah.
So the Knitted Knockers, of course, are helping so many women locally throughout the country, throughout the entire globe. But knitting itself, you're a lifelong knitter and nearly a lifelong nurse.
Yeah.
Outside of the knockers, how do those things interact for either yourself as a healthcare practitioner or for your patient?
Well, some of my patients come in and they don't have any hobbies at all, and then I always encourage them to get one, and I always mention knitting and crocheting. Because it's been shown, they've done medical research on people who knit and crochet and shown it actually helps to lower your blood pressure. It helps for your mind to keep active, which has been shown to help stave off dementia and Alzheimer's. And it gives you something, the repetitive nature of knitting and crocheting just helps to calm the nerves, soothe the soul.
It is very contemplative and centering, I guess.
It is, very much so. And I've always loved doing it. And just to be able to do something that I've done since I was a kid that also helps my patients, that's very, very satisfying.
Right.
And we always tell our ladies who knit, you never know who may be wearing one of the knockers you knitted when you started in the grocery line, or a story I was told the other day that one of our guild members was talking to her physician and talking about knitted knockers, and her physician was actually wearing one. And so who knows who's wearing them. I was at a luncheon talking about knitted knockers and getting my knockers out, and one of the ladies who was in her 80s again in the audience pulled her knocker out the bar and said, "I'm wearing one too." And so how what we do knitting wise and for ourselves can also help so many people, whether that's hats for the homeless, scarves for the homeless, or blankets for babies, or red hats for babies, or knitted knockers. You're helping yourself and somebody else.
I know just from our customer base and many of our friends in the guild, there are a lot of medical professionals.
A lot, yes.
A lot of medical professionals who knit or crochet as a hobby.
Yeah.
Why do you think that is? What do you suppose?
I think, it is stressful. The work that we do is very stressful.
I imagine.
Daily, you're dealing with people at some of the worst times in their lives. And for you're there for them, and you're not going to show them any of the stress that you're feeling. We have to get it out somewhere. Yeah. So it's great to sit down, and knitting in itself, you do it on your own, but it's also such a community, because you just go sit with all your knitting friends, and the act of just knitting and chatting with friends, it just calms you down.
Right.
It's good for you, and I think so many more people should do it.
Very good. So we will be back together later this month for a knocker stuffing event.
Yes, the 26th of October.
So she can't stuff all the knockers herself.
Yeah,
so
I've tried. It doesn't work.
We've been creating the space, maybe quarterly at this point, for her to get all of the empty knockers. We don't have an unstuffed one here.
No.
But they come to her flat and open at the bottom. They're turned in open at the bottom so that they can be stuffed, and then the recipient can add or remove filling as needed, and then cinch it shut. But we need help getting all of those in. Yeah. So if you are local to us here in Bakersfield, that information will be out there. But we'll try and post a little hello from the knocker stuffing event as October wears on, just so you can see the amount of community engagement and that process from receiving the little knocker skins to...
And you don't have to knit to come to the stuffing event. You can just come and help stuff.
You have patients and colleagues who have come to the events to participate.
Just because they want to give back too.
Yeah.
So I and I still encourage them all to try and take up knitting.
Right.
It's not something a beginner knitter can start with, but
Right.
as soon
You
as
can
they
get there.
yeah, you get there. And, you can get
And
there
I know
very
some
quickly.
people have come in for knitting lessons from us because this is their goal.
Yeah.
I want to knit a knocker. Where do I start?
Yes.
Well, maybe not with the knocker, but we'll get you there.
Yeah, definitely.
So I know it does inspire people to get involved with the craft, which is good for those reasons
Yeah,
you mentioned,
yeah.
just personally and helping the community.
Yeah, and I think I know there's a doctor's office. It's in the UK. They actually have knitting in baskets in the waiting room because of the effect it has on patients, and encourage them to take it
That's
up.
true. I have a high degree of medical anxiety, so when I knit in my doctor's office, like waiting, it's just like this.
Right, yeah.
Like if that's lowering my heart rate, I would hate to see what it would be
Right.
if I weren't knitting.
Yeah.
Well, thank you very much, Jackie.
Thank you. Thank you for your support of my knockers.
Yes, I just bringing together and lifting them up.
Right.
So yeah, your October is a busy month for you,
Yes,
and you've
it
come
is.
to chat with us. So we appreciate that.
Thank you.
Thank you. So thank you for tuning in to this special episode and interview. Thank you for
Thank
being
you.
with us,
Yeah.
and we'll see you soon.